I was born after my mother had lost 3 siblings. My own father actually got renal failure. When I told Professor Mengate that I want to do orthopedics, he was very happy. Being the first orthopedic surgeon in Eldoret, there was really nothing. But I felt I must come home because I really felt that I owe so much to Moi University. So we did a curriculum from scratch. 2012, we took our first postgraduate students in orthopedic surgery. And that was it was a landmark because it was the first one in this country. Yes. Because I can see you have a fracture, you need surgery. But now you have to pay. Yes. So that became really very, very difficult for me and sometimes I had to go out of my way to make sure I operate the person so long as he is able to meet some of the requirements. So it was not really like a full business. And that is how we started St. Luke's Orthopaedics and Trauma Hospital.
Hi, and welcome back. For those of you who've had elderly parents, you've had people with bone or joint problems, I'm sure you've heard about St. Luke's Orthopaedics and Trauma Hospital, and you've heard of the legendary Professor Kibor Lelei. Want to know more? Because this week we have him on the channel, we have the man himself, and we'll be speaking to him. And man, he has an interesting story. And we spoke to him at length, and he gave us wonderful insights to his life and to his practice. So tune in and watch this video. It's one you don't want to miss.
First of all, I'm really happy and pleased to participate in this show. And thank you also for having had a thought of interviewing doctors and understanding them. So I'm really happy to be part of this presentation. As you have correctly said, my name is Professor Lectary Kibor Lelei. Yeah. And I think it is interesting. Probably I can start from how my names came about so that you might understand why I chose medicine in the first place. Yes. I was born after my mother had lost 3 siblings. So in the Nandi culture, when a child is born after following loss of the previous siblings, they have to do some kind of ritual. And that ritual, they have to pretend like that baby doesn't belong to that family. So what happens is once the baby is born, in my case, I was taken and left on the roadside. And then they pretended like somebody picked this baby on the road and brought back home. Okay. And most of the time when you have such a situation, they have to give you a name. In Kalenjin we call it Tegeria, yes, okay. For those who understand it. But that was the culture. It was to cheat the evil spirits that this child doesn't belong here, just in case there was an evil spirit in the family. So that's why I'm called Kibor. In other words, I was found along the road. Okay. And also because my mother had a lot of challenges, she had to attend the clinic, which was very rare those years. So they gave me the name Lectary, which means Daktari. Lectary is actually Daktari. Yeah. So I became Lectary Kibor. Okay. And those are how my names came about. And this actually is very important for me because when I was called Daktari, as I grew up, I made it my passion to become a doctor. I didn't even have to think twice. As I grew up, I just grew up as a doctor. Even in primary school, when there are these drama clubs where there is somebody to be supposed to be a doctor, they didn't have to look for anybody else. Yeah. So I became a doctor like that all along. I acted as a doctor in primary school. Even as I went to secondary school, I also looked for subjects that will lead me to doing medicine. So that is how my names came about, and it impacted on my profession.
So you're called Kibor because you're found on the road, and Lectary because there was a lot of hospital involvement. So how was your early life? Did you enjoy school? Already think about medicine? I think you've already said that from early on you never had any option really. You knew you're going to be a doctor. So I would imagine your primary school you were already geared towards being a doctor. How was your primary school and high school experience then?
Yeah. Yes, thank you very much. So actually, I was born in Tanzania. My parents actually were in Tanzania at that time. So I was born there. I studied my school there. And those years, there was no nursery school. We just used to go to standard 1. It's not like now you have PPP, then you have so many other things before you reach standard 1. That time you just go to standard 1. So I went to standard 1 in Tanzania, 1 and 2. Standard 3, I came to Simat Primary School, which is not very far from here. And that was a very, very simple school. Our classrooms were grass thatched. The floors were mud. There was no tiles like the way we have now. So it was a very, very simple school. And I stayed there until standard 7. I did my CPE exam. And after the CPE exam, I went to St. Joseph Secondary School in Kitale. Now, from there is when I started now narrowing down towards medical courses. Because for me, I had already made up my mind. Even during career choices, I didn't have to choose anything else. I just knew this is what I'm doing, and that is how I went ahead. So I had to do subjects that involved biology, physics, chemistry, and of course maths and English as compulsory subjects. So after that, lucky enough, I passed well. So I went to Form 5 and 6. And also during that time, Form 5 and 6, you could go to anywhere in the country. There was nothing like county, where you have to go to your county or something like that. And because my friend who was ahead of me had gone to Muhoho High School in Gatundu. So because he was my friend, I decided to choose the same school. So I actually went for A-levels in Muhoho High School, Gatundu. And reaching there, I did the subjects that were leading to medical school. So I did biology, physics, chemistry. Those years we used to call it PCB, and sub-maths as a fourth subject. So we did that, and in 1979 is when I did my A-level exam. Yeah, so then I went to medical school, Nairobi, University of Nairobi. We didn't have any other choice. It was the only medical school in the country at that point. So I went through the medical school. It was a 5-year degree course. And when I finished in 1986. One of the things that happened when we were in medical school was the 1982 coup. Okay, I don't know that some of you could have read history. We had a coup in 1982. And that coup was very dramatic. Because the people who were conducting the coup, those are the Air Force. They came to the university. Okay, they came with guns and all kinds of things because they wanted the students to join them. And actually, quite a number of students joined them. Me myself, I didn't join. I just stayed in the hostels, and we stayed in the hostels for about 3 days. That time, the dining hall is closed. You cannot go to town because there was a lot of shooting and all that. So we stayed. I remember myself eating raw eggs just to keep myself alive until the third day when we were sent home. Yeah. So that was in 1982. And we came home for 14 months. Okay, we were home 14 months, reporting twice a week to the police. Yes. So that extended my medical school. I would have finished in 1985, but now I had to finish in 1986 because of that. Yeah, and then after the medical school, I came to Nakuru. That's where I did my internship, Nakuru PGH, Provincial General Hospital. That's where I did my internship. That was in 1986. And it was not remarkable. It was quite good. At that particular time, I didn't know which area of medicine I would go for.
So, Prof, you're telling us about your medical school. You told us you did 5 years of medical training, and then the coup happened, and you had to stop school for 14 months, and that explains why from 1979, 80, all the way to 86, you're in medical school. So, Tell us about your medical school. Did you enjoy learning in medical school? What were your favorite things in medical school? At that point in medical school also, did you start imagining what you were going to be beyond being a general doctor? Just tell us a bit about that so that the viewers can try and see and learn from you.
Yeah. The medical school was quite exciting because for me it was like my dream come true. So I really enjoyed my stay in medical school, especially anatomy. I remember when we first went in first year, that is the shock of all medical students, the anatomy subject. For those who are not familiar, anatomy is where you are given a body of a preserved body, and you have to study the body parts. So you do dissections so that you really understand how the human body is made. So usually it's very shocking because some of us had never seen a dead body or handled a dead body, but here you are in your first month. That's where you're in anatomy class. So for me, it was, first of all, it was shocking the first 1 or 2 weeks. You don't even feel like eating meat. Some of us stopped meat for some time because of what you're seeing in the anatomy class. But after some time, you get used. By second term, third term, some people even would not even wash hands. They come from the mortuary directly, the anatomy room, direct to the dining hall. But initially it was shock. We have some students who actually abandoned medicine because of the cadavers. Yeah, I don't know whether you had some in your class.
Yeah.
Yes, but it is actually shocking. But that is the basis. That is how you understand the human body. And all these branches of medicine are based on that understanding that you get in that first year. So the other subject which I liked was physiology, the human function. How the body functions, and usually it's very interesting. It's like a story, how the kidney works, the heart works, and things like that. The one I didn't like was biochemistry. I think that was a very tough subject for me. But generally, first year I really enjoyed. The clinical years, of course, were the best because now we're handling patients, we were taking histories, examining, learning how to examine, and how the treatment is given. So the clinical years were my exciting years. The only challenge we had were our examiners, our lecturers at that time. Those years we had very harsh lecturers. I think lecturers nowadays are mild. Those years they were British trained, most of them, and they were really harsh. They were not friendly like the way they are now. I remember we used to have one, if you, after your exams, he would come and announce the results in the class. So he would say, our goal bearer is so and so, and the goalkeeper is so and so. So if you are last all the time, you become a goalkeeper every day. So you will not want to be a goalkeeper next time, okay? Because he was really very harsh. The clinical exams were also very stressful. I remember one particular one, which was it was my clinical exam in surgery, and we went through the case presentation and then, of course, the question answer by the lecturers. And it was very, very stressful. It was a condition which I had not read so well. So now, after the exam, the patient actually gave me 20 shillings to go and take soda. Yeah, because he said, you've really been stressed. Yeah, but that was a medical school. At the end of it, we were all happy and celebrated the clearing of the medical school. Yeah, so I finished in 1986, and then
proceeded to internship.
Then I had internship.
At that point, like in medical school, did you already have an inkling towards? Because for most people at that point, you're starting to think, am I going to be a physician, do medicine? Am I going to be a pediatrician, do pediatrics and take care of children? Am I going to be a surgeon? Am I going to be an obstetrician, and so forth and so forth? Did you at that point start thinking about what field of medicine you're going to go into?
Yeah, thank you very much for asking that. Actually, when I was going through the medical school, there are two things that really interested me. One was surgery, because I really liked being in theater. It was exciting seeing the surgery being done and all that. So I liked surgery. The second one was pediatrics. Somehow I had liking for children, and so in my mind I told myself I'll be one of these two. I will either be a pediatrician or a surgeon. Yeah. Okay. And I also liked pediatrics because their diseases, you know when the child is okay and when the child is not okay. Some of these medical patients, now that you're a physician, some of these medical patients, you can never know whether they are really sick, whether they have recovered, whether they are getting better. But for children, it is very clear. You can tell when they are okay and when they are sick. So that excited me. And the other one, of course, was surgery. Yeah.
Okay, so you finished medical school successfully. That was back then. And then you were telling us about your internship. Tell us more about that. You said you went to Nakuru.
Yes.
Yeah.
Yes. So I went to Nakuru PGH. Yeah. That is where I did my internship. The internship centers were very few. So you had to choose where to go. And at that time, the doctors were not many. That was in 1986. So even before you go for internship, we used to be given advance salary. Okay. Right now, even people don't even have. But as we were given advance, so that you can go and be able to get yourself a house and start. So that's when I went to Nakuru PGH. It was a very nice experience for me. I really liked it because we had now more responsibilities. You could see yourself actually helping the patient. If it is putting a line, giving medicines, giving blood, participating in surgery, assisting the doctor when you're doing surgery, in deliveries and maternity cases. So it was really a very exciting time for me. I enjoyed myself in internship. Yeah. Yes.
So that should have taken you, I think, a year. And from Nakuru, where next did you proceed to?
Yes, so it became very dramatic, what happened to me after internship. Because at the end of my internship, I was going to remain in Nakuru. Okay. But there was a need for a medical officer in Iten, in Iten District Hospital. And nobody wanted to go. Yes. But the PMO at that time was a very harsh person. Okay, we not say names today, but he was very harsh PMO. So he just came and said, Lelei, pack your things. You are going to Iten tomorrow morning, and he's sending a vehicle. So I tried saying, oh, I need to pay my rent, blah blah. He said, no, that one will sort out. Just pack your bag and come here in the morning with your bag. And that's what happened to me. So in the morning, I came with my bags, and I went to Iten District Hospital as a medical officer. And that is actually where I stayed for the next 2 years before I went back to medical school. And Iten is even where, when I was an MO in Iten is even where when I got married. So maybe it was a good plan to go to Iten. Yeah.
So you were in Iten for 2 years as a medical officer, and then you went back to school?
I went back to medical school now for general surgery. Yes, at that particular time we didn't have orthopedics. There was only one surgical course, M.Med in general surgery. So I went there in 1993. Yes.
Okay. And how was your experience doing your master's training and your residency training in surgery?
Yes. It was a very good training because it was actually called general surgery. So what it means is you actually do a bit of every part of surgery. Okay. So you will go around all the disciplines of surgery, all the sub-branches of surgery. And the first year normally is the basics. So that is when we go back and again revise our anatomy in a more detailed version. We learn also physiology and pathology. Yeah. So we did that in our first year. Then after that, we went now to Kenyatta Hospital, where we now rotated in the different surgical disciplines. and usually it's very interesting because you'll get to know where you feel your hands work better, because you'll go to pediatric orthopedics, pediatric surgery, you go to ENT, you go to abdominal surgery, you go to neurosurgery, you go to orthopedics. So by going around like that, it gives you an overview of all the branches of surgery, and from there you can decide where you are comfortable. Yes. Mm-hmm.
So I guess for you, were you at that point having a feel towards orthopedics, or you just like surgery in general? Anyway?
Yeah. Going around like that was good, and this is where mentors or teachers really make a difference to somebody's life, because when I went round, I liked pediatric surgery. Okay, just because I even in undergraduate I liked pediatrics, so I said I think I'll do pediatric surgery.
Oh.
But the problem came because, unfortunately, at that particular time, there was one lecturer who was never my friend. So we never, every time we are operating, I'm not happy or something has gone wrong and things like that. But when I went to orthopedics, people were very friendly. Everybody was very friendly. The professor there was very friendly. He became my friend. He supervised me in my thesis and was very, very friendly. So now my choice between the two was now clear cut. So I did more time in orthopedics and qualified as a general surgeon, but leaning towards orthopedics.
With an interest in orthopedics.
In orthopedic surgery.
And that your completion was when? When did you complete your?
So that was in 1994.
Okay.
That's in 1994. Yeah.
And then what did you do from there? You came back to Iten, or you came to Nakuru, or how did that go?
Yeah. So again, that is another another dramatic experience. Yes. Because what happened was initially I had wanted to come to Eldoret, but there was a need for a general surgeon in Kabarnet. So I was called to the Afya House. That time I was still in Kenyatta. I had not even left Nairobi. I was still in Nairobi, because after my masters, I went to work in Nazareth, Locum. That is just Nazareth Hospital in Kiambu. So I was still in Nairobi, within Nairobi. So they called me to Afya House, said, now we want you to go to Kabarnet. They need a general surgeon. Mm-hmm. The general surgeon who was there had come back to Nairobi. So I decided maybe let me ask him how Kabarnet is. And when I talked to him, he told me, never go there. That time Kabarnet was still very low. Of course, right now all hospitals are the same. But at that time, Kabarnet was a very low in terms of surgical practice. They didn't have the facilities. So the surgeon was most of the time idle. So he told me, never go there. Never go to Kabarnet. So I told the person in Afya House that I'm not going to Kabarnet. I want to go to Eldoret. And he became adamant. He told me, either you go there or we stop your salary. And but because I was already doing locum in Nazareth and I was happy with what I was doing there, I decided maybe even if they stop the salary, it's okay. Yes, because I already have somewhere else to work. Yeah. So then I told him, no, I'm not going, because the colleague who has come from there has told me, if you go there, you'll not grow, you'll not develop surgically, because most of the time they don't have facilities, and you'll be idle. So I told him I'm not going. So the next month, of course, my salary was stopped. So I continued working in Nazareth. So I worked there as a general surgeon. So I worked in Nazareth for some months. And then from there, the same sisters, it is a Catholic hospital. So the same nuns have another hospital in North Kinangop. It's called North Kinangop Catholic Hospital. So the surgeon who was there left. So then I was posted from Nazareth to North Kinangop. And so that's where I continued working as a general surgeon that time. And I worked there also for almost a year. But my wife was in Eldoret and she was not very happy that I'm very far. so she looked around and found, and that time Mediheal opened.
Okay.
So when Mediheal opened, my wife went there and asked for whether they need a surgeon, and they said yes. So I came to Mediheal as a general surgeon. Yeah, yes, in 19, yeah. Yes.
Interesting, that's 1990?
That was now 94, no, 95.
95.
95, yeah. Mm-hmm.
Wow, so then you came to Mediheal. So how did you move from Mediheal to MTRH now?
Now, so when I came to Mediheal as a general surgeon, I talked to Professor Mengech. And Professor Mengech, that time now the medical school was starting, and they actually wanted people in the surgical department. So I joined Moi University, yeah,
as a lecturer in surgery,
in general surgery. Yes.
Okay.
Yeah. So because of that, then I was doing my surgical cases in MTRH. So I worked in Mediheal, private practice, and did my surgical cases here in MTRH. Yeah. Mm-hmm.
Very interesting story. As I can see, it's been a lot of drama along the way. Yeah. So at that point, you came back as a general surgeon. So I believe you must have worked for a while before you then decided to specialize in orthopedics. Yes. And what was it that made you now?
Yes, that is true. So when I joined the medical school as a general surgeon, I still had my dream of becoming an orthopedic surgeon. And Professor Mulimba, who was my mentor when I was in medical school, even we kept on talking, and sometimes I would go and assist him when he has an interesting case. So I talked to Professor Mengech that I want to do orthopedics. At that time also the students didn't have any lecture in orthopedic surgery. So they had to go to Kenyatta, they had to go to Nairobi to go and do a rotation in orthopedics. Okay. So it was also expensive for the university to send students to Nairobi to go and do rotations in orthopedics. So when I told Professor Mengech that I want to do orthopedics, he was very happy because it meant that once I come back, the students will have to be staying here. So when I talked to him, he accepted. He just took a phone call and called the dean of University of Cape Town Medical School, and they just agreed on phone that I should go there and do orthopedics. Yeah. Okay. Yes.
So you went to Cape Town, and how much time did you spend in Cape Town? I believe you must have been at Groote Hospital.
Yes, we were in Groote Hospital. So I stayed there for 2 years. It was just like a top-up because when I was in M-Med, I spent quite a lot of time in orthopedics. So when I went there, I did 2 years. But before I went back to KNH for 1 more year in the Department of Orthopedics. Okay. So I stayed in KNH for 1 year, then I went down to Cape Town for 2 years. Ah. Yeah, and then after that is when I came back now to work as an orthopedic surgeon. Yeah.
And you've been an orthopedic surgeon ever since.
Yes.
It's been an interesting story here. We've heard from Prof, and a lot of drama in his life. He had to lose his job at some point because he couldn't just see himself working in Cabernet, and he had to work in private practice for a while in a private hospital in Nairobi, and Mrs. Lelei had to look for a job for him. So that's an interesting part of the story. So Prof, I think then you came back, you were a full orthopedic surgeon now. Yes. And was teaching at Moi University, yeah, with the legendary Prof Mengech and others. And I think by the time I came in also, you had been doing orthopedics for a while.
Yeah.
So at what point, Prof, did you think of venturing beyond MTRH? And at some point you began your own private practice and eventually came up with the idea of St. Luke's Orthopaedics and Trauma Hospital. Tell us about those early years as an orthopedic surgeon, and what motivated you to then take the bold step of starting your own private practice, your own orthopedic hospital, and sort of starting St. Luke's? How did that go?
Yes. Yeah, so as I worked as an orthopedic surgeon in Moi University, and of course operating in MTRH, I really felt there was something missing. At that time, first of all, orthopedic equipment were very scarce. Being the first orthopedic surgeon in Eldoret, there was really nothing. I came to a place where there was nothing. First of all, when I finished my my training in orthopedics in Cape Town, I got a job there. But I felt I must come home because I really felt that I owe so much to Moi University. Professor Mengech had organized for me to go. They paid for my upkeep, which I was using to maintain my family here in Eldoret. So I really felt I have to come back. And that's when I came back. So when I came back, I found MTRH, of course, there was very little. At that time, most of the orthopedic practice was very little surgery. Most of the time, we were treating patients with the traction, with the plaster, and things like that. So, and yet on the other side, we had been operating patients, putting plates, doing joint replacements, doing spine surgeries. So I felt that we really need to develop our department here. But unfortunately, of course, government systems, they will not be able to bring all those things at one go. So I really felt something is missing, yes. And that is why I went, I took an extra step to start now importing some implants as an individual, so that to bring up the orthopedic practice in the region. So we actually started importing nails, screws, plates. So we were able to use those ones now in patients in MTRH and also in private practice around. But I still felt that we need a facility which would really look into the needs of orthopedic patients. That was like my mission, that once if I reach there, then I will have done what I wanted to do in life. So that's when I started now a private practice. First of all, I had a private clinic, which I used to go, and also operated in the private hospitals around here. Okay. But eventually I felt I should have something that I can control. I can manage patients the way I feel is the best way, the way I want. And that is how we started St. Luke's Orthopaedics and Trauma Hospital. So we started it was just a small, it was an old house, which was actually residential house. But we kept on expanding it, building it, adding things, and acquiring more and more equipment as finances can allow, until where it is now. Yeah. So it was more like I really wanted to offer something that can help our patients. Yes.
Interesting. I'm happy to say that I was there when St. Luke started in 2013, I think.
Yes, around there.
And it's really grown. What has been some of the highlights of starting St. Luke's, and some of the best moments of your career in orthopedics, as well as your career as a proprietor of St. Luke's?
Yeah, so thank you very much. A hospital has many things. As you know, there are so many things. There is the clinical part, there is the financial part, there is human resource, it's cafeteria and all that, all those things. But the way we started St. Luke's, even from the name you can tell it was basically focused to be an orthopedics center. But once we started, we realized that you cannot just run just in one discipline, because first of all, the patients are not many who can afford to come for orthopedic surgeries. Secondly, we found that some patients come with orthopedic problem, but they also have other issues. So it became difficult to just have a purely orthopedic unit. So I had to keep expanding, adding other things, until we had even to add maternity, which looked like out of the way, but it's because most of the patients who come, they want to have a total care. Yeah. If they come there, they want their child to be attended. They want to see a physician. They want to, next time they are pregnant or they have a child who is expectant, they have to come back. So we had to cater for all that. Me personally, it was very challenging for me because I really want to offer services. But there's the financial bit.
Yeah.
And that is usually the painful part. Because I can see you have a fracture, you need surgery, but now you have to pay. Yes. So that became really very, very difficult for me and sometimes I had to go out of my way to make sure I operate the person so long as he is able to meet some of the requirements. So it was not really like a full business for people to pay back, to pay for the services. And that was quite a challenge in a health institution, because at the end of the month you need money for salaries, you need for the overheads and the supplies and things like that. So that was the big challenge. Now when of course NHIF came, I was a bit happy because at least it can cover some bit. Then insurances also started coming and things like that. So all those helped. But otherwise, the finances was a main challenge as we ran St. Luke's. So we started a charity organization. We used to call it Bone and Joint. Yeah, we are reviving it now actually because it had lapsed at some point. But we are reviving it now. It was called Bone and Joint Foundation, whereby we raise money from companies, well-wishers, and that money we keep it for needy patients. At the moment we have been focusing on children. So if we have children with deformities or with injuries, we can actually be able to help those even who are not able financially. So we have been going to some of these children homes around, and those with disabilities and they have no other source of income, we come and help them and take them back. So running a health facility is not easy. It is it's a challenging thing because there are so many things in a health institution that do not pay you as expected. Sometimes the insurance collapses, and yet they have gone with the hospital money. So you find you are not able to make your ends meet, or sometimes patients are not able to pay. You've done the surgery, or they develop some complications after the treatment, so you find they're not able to pay. So it is usually the difficult part is the financial bit. But for me, it's also exciting because we are able now to do surgeries that if we didn't have St. Luke's, would not be able to be done locally here. Now we are able to do joint replacements. Right now we are replacing the hips, the knees. We are also replacing the shoulder and the elbow. For the shoulder and the elbow, we might be the only institution now in the country doing shoulder and elbow replacements. We have been doing bone lengthening, like people who have short legs or deformities. We are able actually to do bone lengthening. So we are able to do things which it would have been difficult to do them elsewhere because they need a lot of resources and time. So in public institutions, sometimes they are not able to do all that. So St. Luke's has brought in a new angle to the treatment of orthopedics in this country. Yes. Yeah.
I know. I must say, it's been very impressive watching St. Luke's, and I also remember back in the day when I first landed in Eldoret. The orthopedics care was just picking up, and at that point, I think the only thing that was happening was signals. But when St. Luke's came in, of course, then the hip replacements came in, and shortly after that, you embarked on advancing your skills to a new generation of doctors. Tell us about how you envisaged and conceptualized the orthopedics training program, the master's training program at MTRH and Moi University.
Yes. Yeah, that is also another interesting part of my training as an orthopedic surgeon, because the fact that I had to go outside the country to do orthopedics made me think twice and said, if we continue this way, then we'll not have enough orthopedic surgeons, because you have to have resources and support and all that to go into orthopedics outside the country. Most of our lecturers trained in UK. So looking at that, I felt we have to start a program to do orthopedic surgery. And even when I looked at myself when I came back, I had to do so much because I was alone. I was the only one who knew about orthopedics, real surgical orthopedics. So I had to recruit clinical officers and all that to help me in surgery and in the wards and all that. So I really saw we need to start a program to train orthopedic surgeons. And we actually started ahead of Nairobi University because I called, there was a doctor who was in Kijabe, one of the American surgeons. I talked to him and we started drawing a curriculum, yes. So we did a curriculum from scratch, just using my mind and trying to remember what I went through in Cape Town and in the University of Nairobi. We're able to start a program, yeah. And the support also from Moi University itself, because Professor Mengech was also wanted these things to get started. So he supported us, and by 2012, we took our first postgraduate students in orthopedic surgery. Yeah, and that was it was a landmark because it was the first one in this country. Yeah. Yes, yeah.
No, very remarkable. For the viewers who might not know, Eldoret and Moi University was the first place to offer specialist training in orthopedic surgery, and that is thanks to Professor Lelei. He's very humble about it, but that was really, it was a monumental task. And right now, I think we've trained more than how many?
Yeah, we're talking about 80 or something like that now.
More than 80 surgeons.
Yes,
orthopedic surgeons.
Orthopedic surgeons, yes, from here.
At Moi University.
Yeah.
Okay. So I think it's been interesting. I think your professional life has been interesting, Prof. And I think recently again, then you got elevated from a doctor, senior lecturer, to a professor.
Yes.
Tell us briefly about that also.
Yeah, so these are the hierarchies in the university. Yes, so I joined as a lecturer. That was in 1995 when I joined Moi University. I joined as a lecturer, and because you see, for you to progress in the university, there's a criteria that you have to have. You have to publish a particular number of papers before you can get promoted. And because of the way our life was at that point, we were extremely busy. I'm sure you saw how we used to run all over these hospitals, and no time, and then the few minutes you have, you're also teaching, you are doing other things. So to really grow in academically was a challenge, yeah, and that's why it took a longer time to get to where I've reached now. But I was still happy because apart from not progressing academically as fast as I would have liked, I was improving the clinical services in the area. I was training new surgeons. I was bringing in new skills, bringing in the implants for people to be able to use, and things like that. So I was really happy with the way I was working, although academically I should have been writing more papers and things like that. And sometimes when we would have nice articles, we'd go present in the conference, but we forget to publish them. So we lost quite a lot there. So I started as a lecturer, and then after I think about 6-7 years, I became a senior lecturer. And then from there, I felt that probably now we need to, because the years are also going, I felt that probably I need to reach the level of professor before I retire. So that's when now I had to write a few more papers. And it was now easier to write papers because now we had postgraduate students. So they would do their thesis, or if I have an interesting topic, I would ask them to work on it, and then we can write a paper. So it was easier now to write papers because of the postgraduate students. And because of that, I was lucky to be promoted to associate professor now. Yeah.
So you are now an associate professor.
I'm now associate professor
of Orthopaedics at Moi University.
Yes, yes.
Congratulations, Prof.
Yes.
Although it's been a couple of years now.
Yes.
But I think that was well deserved. You've done so much for this country, and oftentimes I think people don't really appreciate the much that you've done, Prof. But we really appreciate that you've given your all. You've brought a different perspective into this city, and you've even gone ahead to train a newer generation. And I'm sure all these people are offering services across the country. So what are some of the exciting moments or some of the highlights of your career that you look back and you marvel about?
Yeah, it's only that you can't remember all the good things that has happened in our careers. But medicine generally, you have a mixture of both. You have a mixture of good things, and you also have a mixture of problems that arise. I think there's the one of the first things which I did when I was a medical officer in Iten, which I still remember up to now, is a child who was born. There's a child who was born and had pyloric stenosis. Yes.
So blockage of the stomach.
Yes, blockage of the stomach, just the outlet of the stomach. So this child was vomiting a lot. So because I was just a medical officer, I was even just post-internship, I sent the child to come to MTRH. And the father came to MTRH. At that time, MTRH was very poorly managed at that point. So the father came with the child, and there were no linen. The ward was, of course, was in very poor condition. Stayed there for 2-3 days. There is no attention. The child is vomiting. And so when the father saw that this child might actually die, he came back with the child to Iten and told me, you do what you can do. If he dies, fine. If he lives, fine. Yeah. So of course, pyloric stenosis I just read a bit in passing in undergraduate. I didn't even know much about it. So at that time there was a surgeon called Dr. Gadvi, who was a general surgeon here in MTRH. So I called him, and he told me, okay. He told me, yeah, you try, you do it. And we talked about it. Told me how to position the child. How to, of course, do a small lap, and then open the annular pancreas, yes, so that the stomach can open up. And we did it under local. So I just made a small cross, put a child on it, and tied the hands on the side, and then we put local, yes, and then we made a small incision. And of course went and identified the pylorus where there's a ring of pancreas which is causing that. So we cut it, yeah, and the intestines opened, and the child became okay. He actually healed, yeah, he recovered. And what is interesting is after some years he came and worked in St. Luke's as an accountant. Yes. So that was an interesting. Of course, right now he has left the job. He has gone. He got a job in the county, Homa Bay County. That's where he's working now. But it is one of those things which it shows that you can actually do more. We can do more. Okay. Yeah.
With
so
little.
Yes, with a little, and also with a will, and with correct guidance. Because I talked to him. I talked to the surgeon, and he helped me how we went through the surgery, and it was successful. Yeah. So there are many other things in surgery that have happened that are interesting, but there are also problems that also occur in any surgical practice. Yeah.
Yeah. Generally, of course, surgery is fraught with a lot of risk. Part of it, anesthesia is risky. The medications that are used for pain control and all that, they can cause problems. So Prof, tell us a little bit about your family. I think you've talked about your wife. It sounds like your wife is a very big influence in your life. She is a go-getter. She looked for your first private job. So tell us briefly about your wife and your family.
Yes. So thank you very much. Yes, my wife, she's called Mary Lelei. Yeah, she was a teacher in Moi Girls here, but of course she's now retired. So she's works with me now in St. Luke's as part of the administration. She's an administrator there in St. Luke's. I think the good thing is we had the same kind of mentality, and for us actually our driving force was to help to help people. That's how we grew up, and because also of our Christian background, we knew God has put us here for a purpose, and the purpose was for me particularly was to be a doctor, to be able to help other people. We are not put here to help ourselves. Of course, in the process of helping people, eventually you help yourself. But yes, if you focus on your purpose, what you are here for, then you'll find happiness. And that's actually in our lives, we've done so much to help people, to treat people, to do this and that. And even as I worked as an MO in Iten, that's when I got married, and I stayed with her in Iten. At that time, she was a teacher in Singore, in Singore Girls. So when I was there, my house was like a hotel. I mean, because eventually people learned about us. So patients used to come from my home. My home is in Moisbridge. Plus even patients from around this area, they used to come to Iten for treatment. And most of the time they got late, so they used to sleep in our house. But she did not complain. Most ladies would complain that now all these people, they have come. She did not complain. She was also happy to house them. So we stayed there, and we had so many people coming home, sleeping there, but she never complained. And sometimes I think about it, and I think that was a beginning of some of the blessings that we got, because most of those patients right now, if they have a relative who is sick, they will send them to St. Luke's. Yes, the ones that I helped at that time, even the ones I helped here in MTRH, we were not being paid anything extra, but I would work overtime, work overnight, just to make sure all my wards and my patients are taken care of. They are the same ones now who, when they have a patient, they will bring them to St. Luke's. So whenever you do something that you feel was your calling, you get blessings that go far beyond your time. So anyway, about my wife, so she never complained. She was happy to participate in what I was doing. And even if I work late or I'm in Kenyatta or somewhere, she never complained at all that, where are you, why are you late, and things like that. She would want to support me that, okay, you have patience, go and do it. So she's very supportive. So she worked in Moi, we worked in Iten, then we came to Moi Girls. So in Moi Girls, yeah, I was staying in the school when I was working. When I was working here, we were staying in Moi Girls school. We stayed there until we were able to move out of the school. And then once St. Luke's picked, she decided to retire early. Okay, she retired early to come and assist me in running the hospital. And that has been a very big help because I'm usually busy with patients and theater, but she would help with administration of the hospital. So she's been very supportive all along. Yeah, we have 4 children. Unfortunately, we lost one, so we are remaining with 3 children. The firstborn is a dentist. She's now a dentist in Nairobi. She's also the one who runs this dental clinic here, the Tayside Clinic, where we are now. She's the one who runs this one. The secondborn is the one who passed. The thirdborn is a lawyer. She's now doing a PhD in law. So she's writing her final thesis, so she should be qualifying very soon. and the last born is a biomedical engineer. For him, he's the only boy. The others are girls. Yeah. So for him, he's the one I keep him very close to me. Yeah, because he's the only boy, and so he was torn. He liked engineering, but me, I wanted him to do medicine. So you can see he was in a dilemma. But one day, then he told me, "Yeah, now I think I should do biomedical." Yes,
combined both.
So he's a biomedical engineer. So he's doing medical engineering. So he's doing engineering at the same time. He's on the medical side, and he feels fulfilled that way. So right now he's in Australia, but he'll be coming back soon to help us also run the runs and looks. Yeah, yes.
Yeah. So that's very good. I think it's been an insightful discussion into your life and your passion as a doctor. I think many people can testify that Professor Lelei has gone far and beyond his call of duty to help many people, and that's why he's where he is right now. So, Prof, what are some of the things that worry you in medicine, in your practice or in medicine in general? And maybe we can start with that, and then we'll come back and talk about the future of medicine. So what are some of the things that worry you, especially in the current environment of medicine?
Mm-hmm. Yes, so I think we can look at it in two ways. First one is first of all the affordability of health services. Yeah. Right now, a lot of people need some specialized services, but they cannot afford it. Mm-hmm. So I think going forward, the government has to really think of ways of making health services affordable to the public. Somehow, some of these diseases tend to go for those who are not financially endowed in the community. And yet they need those very expensive services. So affordability is one of the problems that we have, and it's affordability in terms of the patients raising the money for the services, and also the health services themselves to have all the necessary branches and equipments that are needed to do big procedures or carry out different kinds of treatments. So you'll find that somebody might have money, but for you to get a particular kind of treatment, you have to go to Nairobi, for example. Of course, Eldoret has really progressed. Eldoret right now, I think, could be considered almost like number 2 to Nairobi. We have a lot of services now available here in Eldoret. But otherwise, before these people would have to go to Nairobi or go to India or go abroad. Yeah, so all these are things that we really have to work at. But the first one is people should afford at least most of the common medical treatments that are available. And then secondly is equip the facilities. Yeah, so that if you are from Eldoret, you can have most of your things sorted out here.
So bring the services
to the people. Okay. Yeah, so the services can come to the people. Yeah, people sometimes are sent to go to Nairobi. You reach there, they get lost. They don't have enough money to stay in Nairobi. Mm-hmm. So if we can bring the services here and make them affordable, or make the people afford the services, sometimes it's difficult to make things just affordable because of the nature of the equipment that are needed. The other one is the professionals, the doctors. Also, we need to be trained to a particular capacity. Right now, I can see like the doctors who are qualifying. Most of them cannot get jobs. They cannot get further training. So that also reduces the availability of specialists to do most of the practices. So I think we have to find a way whereby we can be able to develop more doctors and also make the services affordable and available. Yeah.
So more specialized doctors being available in more places would be what you...
It would be very good, yeah, so that if you are was in Gishu, you are able to sort out most of the things, yeah. Of course, you cannot do everything, but at least most of the common issues. When you are in Lodwar, when you are in Kapenguria, you are able to do that. So those are the kind of things that need to be done. At least now we have more medical schools. But I see the unfortunate thing is most of the doctors finish. They can't even get any places to do internship. Even after internship, they are jobless at home, and yet patients need them. Yes, yeah.
So something needs to be done.
Yes.
I think I stand in testimony for what you've said. I think some of the things we've done with St. Luke's have also gone a long way to providing services. I think back in 2017, I approached St. Luke's myself, and we worked together to bring kidney transplants to Eldoret, and so far we've done more than 100 kidney transplants, despite the challenges that have been there. Maybe you can speak briefly about that and what your perspective on that is.
Yes, thank you very much. I think kidney transplant has really changed a lot of things in this region. Initially, my own father actually got renal failure, and that was in 1995. Yeah. So he was here in Memorial. He got renal failure. Even me myself, I was still not. I was an MO. Yes. I had just finished my M.Med. I was not even employed yet. Yes, I just finished my master's. So he got kidney failure, and he was here in Memorial Hospital. So he came in unconscious, and of course, with all those uremic symptoms, there was no dialysis, there was no anything here in Eldoret. So I took him to Kenyatta Hospital. So reaching there, they did a peritoneal dialysis. Okay, there was no hemodialysis at that time. So after 2-3 days, he woke up from there. So when he woke up, he, of course, is still confused and all that. He woke up, but he became kind of a stable chronic renal failure patient. So I brought him back home. There was nothing else. I mean, if I wanted to do any more dialysis, I have to take him to Nairobi, and it was peritoneal dialysis, very cumbersome. So eventually, he got a second kidney failure. Exacerbation, yes. And of course, he didn't make it. He died. Yeah. So you could see where we came from. Yes, it was that bad. And then slowly, peritoneal dialysis came to Eldoret. And then from there, hemodialysis came in. Now, hemodialysis came in. Now you had many patients who are on dialysis, but apart from that, there was nothing else. Yes. If you wanted kidney, you have to go to India. Yes. And not many people could afford to do that. So eventually they started kidney transplant they started in Nairobi first, in KNH. That was Professor Awori and the team. They started in Kenyatta Hospital. And then eventually, it was done in MTRH. So the one of MTRH was done with the help of surgeons from Indiana University. So they came and did a few. After that, they didn't come back. So transplant stopped. And the only place which was now going on, which was doing, was Nairobi. And that is when now in St. Luke's we felt that we need to start that kidney transplant. And that is when you and Dr. Viji, yes, you came in, and then we started now the kidney transplant. Initially, I thought we would not be able, yes, because it's something which we knew it is only being done in Kenyatta. But you and Dr. Viji at least encouraged us, and we saw the first patients being done. And to our surprise, patients within 5 days they were going home. They are okay. They are happy, and so we felt this was the right thing to do. And so we supported the program. St. Luke's really supported the program. And eventually NHIF also came in, helped the patients. And from that time on, we have been working together. So St. Luke's has actually been working with Lectary for this program of kidney transplant. Because St. Luke's, we are basically a surgical unit. We don't really manage patients with kidney disease as such. Yeah, because so what was happening was patients were being managed by the Lectary. So they do the pre-op evaluation, matching, and all that, and then they come to St. Luke's for the surgery and come and continue the post-op treatment. Things like kidney transplant, the preparation is more important than even the surgery. Surgery is just a small bit. Yes, the preparation to match them, to have the correct partners, and the follow-up after is also very crucial. So St. Luke's just offers the surgical services, yes, and that's all. Otherwise, the Lectary team actually manages them, and the two have worked synergistically. Actually, we have really helped each other and helped the patients. Yeah.
Mm-hmm.
Mm-hmm. Thank you.
So you've told us it's interesting, and it's as an unfortunate story that your dad actually had to go through kidney failure. Do you have any other family member who has gone through kidney failure, kidney transplant?
Yes, yes, I have had. I have my cousin, a young man. I think he's in his somewhere in his 30s. He got kidney failure. Yes, probably secondary to some kidney disease. Maybe Dr. COHS will tell us. I might not be very familiar. So he got kidney failure. So lucky enough, we managed to pick him up and start dialysis. So starting dialysis at the age of 30 definitely cannot take you very far. Yes. So we did dialysis a short while, and thank God that we started kidney transplant here in St. Luke's. So he benefited from that. So once he's done dialysis for a short while, Dr. COHS was able to walk him up, and we're able to do kidney transplant here in St. Luke's. Right now, he's fine. He's with his family, and he's doing his own business at home. Yeah. Okay.
The last but not least, Prof, is medicine is an evolving field, and I'm sure you've seen for yourself. You've been here longer than any of us, and you've seen things change from the 90s, the 80s, the 90s, and now. What do you think are some of the things that you are excited about in medicine that might be the future of medicine? We hear a lot about AI in the field of surgery. We hear a lot about robotic surgery. What do you think, and what is your vision of what is coming up, and what do you think would be out the field of medicine, and in particular orthopedics, look like in the next several years, maybe 20, 30, 40, 50 years from now?
Mm-hmm. Yes, thank you very much. I think medicine is evolving very fast at the moment. Long ago, it would take a long time for a procedure for medicine to change. Okay, you would find probably, let's say a surgery, laparotomy. You would find you are taught, your students you teach the same thing like that. But nowadays, medicine is evolving very, very fast because of these the new technologies, the AI technology. In orthopedic surgery, right now the AI has taken over most of the things that are going on in the field of orthopedics. If I take, for example, the issue of implants, nowadays we are doing custom-made implants. Because long ago we used to have one size fits all. Like for example, if it is let's say implants for the hip, for the total hip, we adjust the different sizes. But nowadays we are able to actually custom made. Like for example, if a patient needs a total hip, you can actually go and have a CT scan. And then they take that CT scan and do, using 3D printing, actually make implants that are specifically for you. And that produces better results, because if you have something which is matching your anatomy, you tend to recover better and have better results. So the 3D printing is something which has really come up. Or in case you have a very bad fracture, like fracture which is in many pieces, for example, they are able to actually do, with the help of the CT scan, they are able to make implants that can actually tailor to that. Yes. So we are getting more patient-specific kind of implants. And that is very good, because people have different shapes. We are not all the same. Or sometimes when you are doing revision, because of the wear and things that have taken place in the body, the anatomy is not normal. So nowadays we are able to actually do 3D printing, and you can get specific implants. Another area which has also developed a lot in orthopedics is nowadays we have absorbable implants, bioabsorbable implants. So, for example, if a small child has a fracture in a sensitive area, we can use implants which dissolve in the body. So we can fix the fracture, and then over time, those implants dissolve. Okay, and as the child is growing, the implants actually dissolve. It's not like before, where if you have an implant somewhere, you have to come for a second operation to remove it. But now, bioabsorbable implants are also developing. And then, of course, other things that have taken place now is using AI, to do procedures. We have nowadays, let's say if you are doing total joint replacement, we are able to do proper CT scans, and part of the procedure is automated. Yeah. So like long ago, I would have to do all the cuttings and all that. But with this new technology, once we have identified, once we have done your CT scan, we are able actually to put that program into a machine, and we just open, and the machine can actually do some of the cuts in the joint, and that is very precise. So you find the patient actually gets better outcome than when it's done manually. So these automated surgeries, 3D printing of implants, is really coming a long way. Yeah. The other area which is now interesting and I think is something which is worth noting is in the area of oncology. In the area of oncology. Oncology, first of all, the medical treatment has really saved many people. Long ago, if you had cancer, it's like you are forgotten. You know you are going to die. But nowadays, we have so many survivors of cancer because of the medication that is now available. And in surgery, surgery has even improved. Before that, if you had cancer of a limb, we had to do amputation. Nowadays, if you have cancer of a limb and you come to hospital early, we do limb sparing surgery. We are able to remove that particular section, and we use an implant to fill up that part. And the patient is able to walk again, and the cancer is gone. So in oncology also, there's a lot of development. And of course, in future, we are going to see even much more development. Yeah, we can actually replace the whole femur. If your femur is shattered or is infected or is having cancer, it can actually be removed and we put an artificial femur. So, and you'll not tell, somebody will just walk normally, but actually the femur is an artificial one inside. So there's a lot of development which is going on. Yeah, and things are now more rapid. What you have this year, next year is something else. Yeah, so I think medicine is going the right direction. The only challenge that we are going to have, of course, is the finances. For us here, we just have to, just follow what the Western world is doing, because we cannot afford all this research. And even all these new technologies, they are expensive. In St. Luke's here, we have done a limb salvage surgery. We have had a patient who had osteosarcoma of the femur. We are able actually to catch it early on time. So normally what we do, those ones is they start with the cytotoxics for like 2 weeks. Then they come, we excise that tumor. And then after that, they continue cytotoxics for the remaining 6 weeks. And that boy recovered. He's now I think he even finished his secondary school now. Yes. So limb salvage is something that is coming and is doing very well. Yeah, thank you.
Is there room for robotic surgery in orthopedics?
Yes, yes. So robotic surgery, like what I was telling you about when you're doing a knee replacement, it's a kind of robotic surgery. So the picture of the part you're going to do surgery is put into a computer in the machine, in the robot. And so you as a surgeon, yours is just to expose. Okay, so you just expose the bone, and that program that you have put into that machine now takes over. So if it is to divide the bone, if it is to remove a bit of bone, if it is to align something, it does that. Yes. So robotic surgery is now in orthopedics. In fact, I was telling somebody, in the next few years, I actually don't have to go to theater. You just sit in your computer, and the patient is being operated by the robot in theater. Yes, because in that robotic surgery, the one we have now, all yours is just to expose, and then the machine actually does the cuts for you. Yes, so you don't have to use the saw like we used to do. So maybe in future it's even expose and do the surgery. Maybe who knows? So it's possible. Yes.
So I think we've really had an interesting discussion with Prof. Lelei. Is there anything we've forgotten? So as we wrap up, Prof, maybe some take-home messages for the viewers. We have many viewers. We have the general public who will be viewing this video. We have medical students who will also be viewing this video. We have some of your trainees, the orthopedic surgeons in training, who will be viewing this video. But I'm sure also there'll be some people in government and in policy making positions who will want to listen to your video. You are an influential man, Prof. So maybe you can give us some take-home messages for the general public, for the trainees, and some take-home messages also for the policy makers, how some of the things they can do to improve the care of patients with bone fractures, or patients with joint problems, or patients with cancer in general.
Yes. Thank you very much. Probably starting with the policy makers. First of all, I would like to thank them for this SHARP program. I think it's an amazing program, because it is reaching to even the smallest person in the society. So I think that is a very good move. And right now, Kenya is one of the few countries where a poor man can get a total hip replacement or get a total knee replacement because of the SHARP program. So I think that is a positive sign. We just need to improve it. Anything, of course, will have downfalls here and there. So you might find people correcting it, others saying it's not paying, it is not this. These are things that can be fixed. So all I can say is the government can help us, especially like now if I talk like from St. Luke's, just to make sure that the payments are met so that the hospital can also continue offering services. But it's a very good thing. I think we should continue with that kind of thing, because financing is a main thing. Secondly is on the health institutions. I think we should upgrade our institutions. And the third one is, of course, on the doctors. We have a lot of doctors now who are trained and are jobless. If they can be employed for further training, so that we have doctors in all disciplines. Kenya, we are able to be self-sustainable in terms of medicine. Our patients don't have to go to India or Europe or Turkey or wherever. I think it's up to the government and the policy makers to train these doctors who are just sitting at home to different disciplines, so that we are able to be self-sustainable. All our patients can be managed within. So I think those are the ones which I have for the policy makers. Otherwise, thank you. I think they are doing a good job. Yeah. And then for my colleagues, mine is just to encourage them that we continue doing our best in our profession. I think the specialization that that each one of us is doing, do to your best. Me personally, up to now, I still read, I still try to research, I still try to find a better way of doing something, and that should be our profession. You see, what happens here in Kenya is you find somebody is a doctor, but I still have to run a matatu to make my ends meet, or have some cows in the village to take to the dairy. So that takes part away some of your professional time that you have used to improve yourself, or to manage more patients, or to do a research, or write a paper, or something like that. So if we are well taken care of, then we can be able to do more for our department. Otherwise, for me, mine is just to thank Dr. COHS for organizing this program, and for those who are watching, for the students, I just encourage you that you are in the right track. Yeah, thank you. Mm-hmm. Yes.
Thank you, Prof. Any question from you, Kikuni? Question from the... I think, Prof, you've been a very good host for the program and for the show. You've given us a very interesting insight into your life. I've really learned a lot about your life. I've learned a lot about your motivation and about what keeps you going. And we really appreciate. I know you could have been somewhere else doing something else, but you gave your time to us, and we really appreciate.
Thank you.
As I said, Prof has done many things in his life. He's changed the life of so many people. He's changed practice in this city, but yet he's a very humble man, as you can see. And for that, Prof, I think you should keep being that Prof that we've always known. So thank you very much.
Thank you.
And
Thank you.
yes,
Thank you.
shake your hand.
Thank you very much. Yes.
Thank you very much, Prof.
Yeah. Thank you. Appreciate it.